Okay. Moving on. So we first begin with the background to my study. And it's very important to recognize the challenges we face as healthcare systems confronting mental health issues. So there is an exponential rise in the burden of mental health care problems. And in as WHO has stated in 2019, that 970 million people were globally living with a mental health disorder. And in 2023, on the World Mental Health Day, it was reported that the global burden of mental health conditions was estimated to be about almost 1 billion. And the disorders usually are anxiety and depression. And out of the 1 million, 260 million people live in the Southeast Asia region with a mental or neurological or substance abuse disorders. The second thing being the fragmented healthcare delivery system. Uh, just a second. Yeah, there's a fragmented healthcare delivery system, and this fragmentation is due to the siloed approaches of mental health care provision, a lack of coordination between the different sectors of healthcare providers, and an insufficient integration of mental health care services into the primary care settings. And this leads to an inefficient care and suboptimal outcomes among the people with mental health needs. There is also a shortage of healthcare staff because the mental health care professionals are unable to meet the needs of the people who are coming to them. It could be because of the growing population, the aging demographics, and the inadequate training capacity. And this shortage undermines the effort to address this demand for mental health care, especially among low to middle income countries. There is an escalating cost of the healthcare delivery, and this cost is a formidable barrier to people accessing mental health services. There are very high out-of-pocket expenditures coupled with the limited insurance for mental health care. And this lost productivity costs about the global economy about 1 trillion US dollars each year. Also, there is a higher occupational stress among doctors, which is that doctors find grappling their own mental health conditions while providing services, and also their demanding clinical responsibilities. So this becomes the basis to why we wanted to do this. And the rationale behind our study was that there is a poor quality of life and mental health status of doctors. And the use and reach of technology in mental health care delivery needs to be evaluated. And doctors are the best study subjects to understand the importance of mental health and use of technology, as the demanding nature of the profession takes a toll on their mental health as well as an overall quality of life of doctors. And there are multiple studies stating compassion fatigue, high burnout, depression, and anxiety, including doctors in India. And the resources are quite poor in our country, which is why it becomes even more challenging and very imperative to understand the importance of mental health and the use of technology. So the objective of our study was to study the attitude and perceptions of technology-enabled care for mental health and well-being among doctors in an Indian setting. And our expected results were the perception of mental health and well-being among study participants, the perception towards technology-enabled mental health care for self and patients, the acceptability of digital medium for mental health and well-being support, and the measures taken by the employees to take care of their mental health and well-being. Their pattern of applications being used by the employees, as well as the reasons for either not using or using online support or apps for mental health and well-being. So our study design was a qualitative study, which was conducted among the doctors of community medicine. Community medicine is a specialty which focuses primarily on primary care provision, teaching, and training of medical postgraduates, as well as community health workers. We used a purposive divergent sampling to ensure the richness in data, and we had 20 participants. 10 were from teaching, and 10 were practicing. Um, the methodology of our study was that all the participants were subjected to in-depth interviews using a standard topic guide after original informed consent. And an informed consent for audio recording of the participants was also taken. The average duration of the interview was about 25 to 40 minutes, and the responses were given in both English and Hindi. This was our study instrument. The topic guide was made in English, but and was intended to explore their attitude and perceptions. And it had questions on mental health, well-being, teleconsultation apps that they use, and also to further analyze what are the enablers, what were the barriers and challenges for the same. So in data analysis, all the audio recorded interviews were transcribed and translated in English. The study was analyzed using in vivo for effective data management, and an inductive coding was done by the researcher with a code book that was prepared. And based on the coding, thematic analysis was done by keeping the objective about the felt need for mental health and well-being in mind. The study used the qualitative data analysis approach by compiling all the interview transcripts and breaking down the data into codes. And thereafter, the data was reassembled and labeled for interpretation analysis by taking the objective. And the validity of the study was assured using a peer debriefing carried out independently among like 2 subjects and to satisfy the inclusion criteria of our study. So the results, we had like 20 doctors, out of which like half of our participants were women, and about like 65% of them were practicing community medicine, and 35% were just teaching. 55% belonged to the age group of 21 to 30 years, and half of them were married. This is the word cloud that was prepared, and and one of the most as is represented, the word difficult, employer, and music, phone, and resident were the most common words that were spoken. In our study code book, this is our code book. We had 18 codes, which were then jotted down into our 4 main themes. So the codes were like advice, attitude, constitution of mental health, the coping, personal and professional, their overlap their overlap in life affecting mental health, the felt need, any mental or physical things, mental and physical health having an impact on their professional and personal lives, and the score they assign to their mental health, and any misuse or use and threshold of their stress. Now we come to the themes. We had 4 main themes: the attitude and perceptions towards mental health and well-being, the attitude and perceptions towards the use of technology for mental health and well-being, the role of professional and personal life in mental health and well-being, and the coping mechanisms they adopted for same. So the attitude and perceptions were assessed using understanding of mental health as a concept, their assessment of mental health, of their own mental health situation, their self-assessment, any variability in their assessment, or what their tolerable stress threshold was, the felt need of the doctors for mental health and well-being, the importance they assign, like the need for any policies, the focus on awareness generation. These were like assessed in this, and the stigma related, which was found to be quite high, the stigma related to mental well-being, and the advice they give to the community as doctors. So mental health as a concept was communicated to them. The term mental health was relating to their physical, emotional, and spiritual health. And the importance, the study participants use terms like mental health is the key, the basis that whatever you want to do in life, and if it is not okay, then there is no point of doing anything. And it affects all age group, all genders, and all occupations. These were stated by the participants. One of the participants assigned that mental health was their central issue, and it affects the overall performance and the need to keep going in their everyday life. So, half of the study participants mentioned the role of medical education and the profession in giving them an understanding of mental health. In felt need, we found that 10 participants reported that there's a very competitive world out there. COVID-19 was one of the causes stated by some that caused a lot of harm to mental health. Then mental conditions, advancing age, any understand abnormality in the personal interactions were all causes for which they need to take care of the mental health. One even stated that it's a very highly competitive world out there, and everybody's struggling for survival. So that in this world full of technology, full of innovations, mental health issues definitely need to be talked about openly, and even doctors should come up and talk. In felt need, they talked about the need for policy intervention, and a lot of them even talked about the need for policy interventions from the government side. It is stated by one participant that they think a lot of policy interventions are required from government side because traditional doctors have been bearing the burden of healthcare in developing countries. So the human resource aspect of organizations really needs to be looked into. And the need for awareness is it's just that people may not be aware of themselves being at risk of problems. And this was in reference to the fact that doctors themselves very rarely are aware that they can also be victims to, say, mental health conditions. The stigma related to participants was mentioned by 8 participants, and some identified it as to be a very significant barrier in seeking care. Only 2 participants mentioned that lesser stigma in doctors for mental health was found to be compared to the general population, that they understand that it's a disease and there's a need for seeking care. And one participant mentioned that very evident stigma exists even among doctors for seeking care of mental health and well-being. The self-perception of mental health and well-being was found that nearly all the participants reported to be feeling satisfied with their mental health situation, while majority of the participants, like 12 out of 20, reported scores of 8 on 10 or even above, while only 3 participants reported a score of 5 or less in their assessment when they gave themselves self-scores. We found a variability in the status of mental health reported among the different life stages and situations by the 14 participants. A specific use of the word fluctuating was found being commented when they were talking about mental health and well-being in at least 3 participants. And for some, mental health and well-being varied across days, situations, or different life stages. Lord even mentioned about in these 3 participants, some even mentioned about, say, seasonal affective disorder and situations like that. In the stress threshold, the level of threshold was done by 10, the mention of that was done by around half of our participants. And variation was found in the tolerance or resilience towards stress, and their capability to handle these kind of stressful situations. They reported the need to identify the triggers and the vulnerability of people, and the moderate stressor of being able to grow professionally in life was something that caused them stress and caused them problems to having mental health issues. The specific advice that they gave to the communities, they saw that there were challenges of stigma among the community as well when they go out to give counseling. And it was mentioned by three participants. Few even mentioned that they focused on mental health, and counseling was targeted to like specific groups, like only after OPD, when they felt the need, they would do it as the treating doctor. And mental health and well-being was reported to be a domain among experts. And there is a need for consult experts, and there needs to be an integration with primary care. And there needs to be a right reach on right people in the right environment, focusing on special vulnerable groups. And the specific advice was reported by 13 study subjects. The attitude and perceptions towards technology, which was our second theme, we found that majority of our participants agreed to the potential of technology in solving mental health problems in the modern world, but mentioned associated challenges and the use of the term like double-edged sword. They did not, majority of our participants did not even did not comment on the comfort level of using technology, but a few did express inhibition, which is around two. And the studies participants mentioned the preference from staying away from some of them stated to be staying away from technology, and thus being a boon as well as a bane. And in technology use, telemedicine and technology-based mental health care was stated to have improved the accessibility among people struggling with mental health. Most participants, like half of them, described it to be a boon and acknowledged the need to develop it further. And the replacement of face-to-face and human connection is challenged. So in a tough situation, it can bring support to struggling individuals and reduce the stigma attached to mental health disorders. Now, in technology use, they even said that it can bridge the gap in human connection due to distance, and the need for companionship is the ultimate comfort to an individual, and technology plays into that by connecting people as families and friends, and even a care provider to like to a patient. And people can find this support system online, are able to cope better in difficult situations, and even if then they're hesitant sharing their feelings in person with people. Nearly half of our participants reiterated that the access to, say, yoga, meditation, and pranayam, which is a type of breathing exercise, courses through YouTube and other applications have had a positive effect in improving the mental health. The technology misuse and challenges that they were mindful of were security and privacy breaches that can happen, the loss of a human touch, and the addiction to social media, and how it harms one's self-esteem were things of concern. And they also raised concern about the excessive use and addiction among uh, children and adolescents, and gaming addiction, things like that. Two of our participants stated that it has the power to aggravate an existing mental condition by triggering events due to incorrect screening. So this might result due to not very accurate diagnosis, which are made through consultations. So in professional and personal life, the role of personal life was stated, a good personal life was stated to have a positive impact. And 3 out of 18 reported that family issues can have a poor effect on their mental health and well-being. Personal life was a very important contributing factor to be found for good mental health. Communication with partners or communication with supportive family members was the key to having a good personal life. Lott stated that the relationship was found to be ambidirectional, and the balance could help them improve their mental health and the outcome as well. In professional life, it was found that work can have physical toll on not just body but also mind. And if the person is satisfied with the work, then it can be rewarding. So professional life also found to have a lot of effect on mental health. And we found that stressful or like if the work is stressful or if the work is not stressful, it can also affect the mental health of the individual. Being part of the medical fraternity, however, does not, being a part of the medical fraternity, it does allow participants to understand the gravity and be more cognizant of their symptoms. So, profession thus was found to have playing a very integral role in our lives. So, challenges and frustrations with work can will lead to a poor mental status was stated by a lot of our participants, and a good sleep cycle was also emphasized upon by a lot. We found an overlap, the overlap between professional and personal life affecting mental health was also asked to our participants, and they recognized a good balance to maintain a healthy mind. The support from a personal front is needed for study participants to support stressors in professional environment. So, two participants mentioned the ability to keep their life separate, but majority of them agreed that keeping them like completely separate is quite difficult, and both have an effect on each other. So one even stated that I think there's a direct relationship between personal and professional life, and I try to keep things in different compartments and not carry the professional life over the personal things, but spilling over often does happen. And one even stated that I don't feel they can be separated entirely, and they go side by side. They definitely go line by line together. In coping and support mechanisms, the coping in general, we found that information about coping strategies at personal and professional fronts and the type of support rendered by employers had a good effect on their mental health. 11 out of 20 participants mentioned the role of communication as a key to coping, and communicating their problems and venting to their partners or friends was found to be the most common form of coping among participants. However, two stated that cutting off all types of social ties can help them during times of stress and allow for self-reflection. In coping and support mechanisms, 6 participants stated that some form of physical activity like walking or yoga or meditation helped them manage their stress, and some had reported for hobbies such as travel, reading books, and listening to music to cope with mental stress. One participant also acknowledged that keeping practical expectations and practicing the ability to forgive also helps them keep their own mental peace. Coping on a professional front, the presence of a supportive environment and a good working equation was stated to allow for everyone to have a better mental outcome. 8 participants credited a good working environment as a means to deal with stress. 2 participants stated that they sought professional help in times of crisis. One stated that while doing their master's degree, they had a situation where they had to reach out to a counselor for more than just advice. They believed that they just wanted someone to listen, and they thought twice before they went there. More in coping, we found that they stated other ways such as avoiding stressful work and making time for themselves to recharge and avoid burnout was one of their ways to keep themselves positive around people. The lack of provision of employer support mechanisms for mental health and well-being at workplace was stated to detriment this type of coping. And there is an unmet need for mental health services among doctors, catering to the challenges that they face. So this one of our participants stated that people think that we are the ones who address mental health, but who will address our mental health? However, there is no one who talks to us and asks us how we are, how our family is. We are addressing everyone's mental health, but no one is addressing our own. Most of our studies, most of the studies have used scales for assessment. In discussion now, we come to this, that they use scales for an objective assessment of mental health and disease status. And this precludes the understanding of the underlying behavior of study participants that needs to be understood. So as to design our interventions better. Mental health and well-being were recognized as important by all our participants, and the unmet need for mental health and well-being and poor support was related to be same reported in our study subjects. Similar findings were reported in a study done in North India by Grover et al. And in South India, Chichira et al. Um, reported high levels of perceived job stress and low scores on personal achievement and subscales for doctors. And high suicide rates were also stated through a newspaper survey. There policies like medicine practicing guidelines by India came into force in 2020 during COVID. However, in our current study, active utilization of technology for mental health and well-being was limited to talking to friends and listening to music or yoga. Only some were familiar with the applications, and none basically used or recommended it to family or friends. Major consultations, however, for diseases like diabetes, hypertension, using, say, the eSanjeevani platform, which which is created by the Apex Institute of Mental Health in India in Karnataka, and they initiated a digital innovation titled eManas. So this was also something which was new because this has found to be this application is found to put more focus on mental health, and it also provides access of telepsychiatry to all. In a qualitative study done by Giva et al., we found communication freedom from judgment leading to avoidance of stigma in using technology for mental health care was mentioned by our participants. So similar findings are reported in our study, where participants suggested the use of telepsychiatry for the avoidance of stigma. Finally, coming to the conclusions, the importance of mental health and well-being was accepted by all the doctors, and the stressful nature of the profession was cited as an important reason for supporting the mental health and well-being. The knowledge of medicine gave the necessary understanding for the importance. The varying status of individual mental health and well-being across different time periods and stages of life was reported. This means that the self-assessment of their own mental health is often difficult and fluctuating. The importance of a good balance between professional and personal life was reported to be necessary for mental health and well-being. Stigma was the concern for seeking mental health care, and issues that were a cause of concern for even doctors. A good support system of family, friends, and peers at work was a major factor contributing to mental health. And having hobbies was also found to be a coping mechanism by many study subjects. There is a lack of policies to support mental health and well-being of our doctors, and study participants accepted the potential of technology in improving their mental health and well-being. However, technology was reported to be a double-edged sword with privacy breach, cost, security, and overuse by vulnerable age groups. And technology use in mental health is reported by most of the doctors, however, was only stated to be used by just one. The limitations to our study was that the qualitative study design was done with a percussive sampling, which obviously limits its generalizability. There was a reporting bias as the study participants knew the researcher, and the association of the researcher with the organization where they received training. The study focused mostly on the negative effects of stress in the process of interview. However, the positive effects of stress and conflict in a work environment can help in boosting performance, and participants did not explore that in detail. And the reasons for inclination of the study participants specifically to few coping mechanisms were not really asked much in detail. Our recommended policy recommendation would be there is a need to limit work hours and provide a safe, feasible technological solutions to doctors and engage them more in their own mental health and well-being. Employee support mechanisms should be available in hospitals and health centers. Applications in the market needs to be supported by well-conducted scientific studies and validated in our Indian setting. And there is a need to advertise uh, this well in community, especially among doctors for further promotion. And mental health program needs to support support development, testing, and use of such applications and services in the community. The national tele mental health program was launched in 2021, which has a significant technology component, and they should harness the gains in the reach of technology for improving the mental health of the population. Disruptive innovations from local NGOs and startups should be prioritized for support and wide-scale implementation by Startup India initiative. And the pending approval of the digital personal data protection bill is a big challenge. And the digital health literacy should be promoted in the community through awareness generation programs in various forms. Thank you.